We are presenting at the American College of Rheumatology Convergence meeting an abstract looking at data from our own institution of children followed over the last fewer than 10 years who have positive results on one of the tests for antiphospholipid antibody syndrome. The results were actually quite surprising. It was important to note that many patients had low positive results, which were felt to be of no meaning. We also had patients who had low titer positive, then we repeated it in a couple of weeks and it was normal. But we did find a group of patients who had elevated levels who were at a surprisingly high risk of clotting and other associated problems. This was a surprise to me because I think most of us would say that clots in general are rare in children. And also, we've had very little data actually on what the risk is of clot in children who have antibodies to phospholipid. This results to me show that it's exceedingly important that we check these studies in children, including those who have no other medical issues. For instance, not everyone has lupus, although many of the patients did. Some patients were just healthy children who ultimately had a clot, that we identify these children and follow them closely for any signs of adverse events secondary to these results. So the way the study was done was Dr. Pandya, who is currently a third-year clinical pediatric rheumatology fellow working with Dr. Doric Erkin in the APS Center, what she did was comb the medical records to look for anybody that had been seen under the age of 18 who had had positive results on one of the following tests, either anticardiolipin antibodies, beta-2 glycoprotein antibodies, or presence of a lupus anticoagulant. Then what she did was discard or take out of the study patients whose results were so trivially elevated that we really thought that they were not going to be at risk. Then what she did was she separated based on how high it was between children felt to be at low risk and high risk. Now we know that these antibodies can be transient and come after viral infections, amongst other things. So what they did was look to see who was still positive 3 months later. And what they found was the ones who had had high titer or high amounts of these antibodies beforehand almost always had high amounts of it 3 months later. But I think the thing that was most surprising was when they looked to see who those patients were and what happened to them, about 25% of those children who had had elevated levels had some sort of event that could be attributed to those results. And for me, the most surprising thing was not everybody had a clear other diagnosis.